This is the 10th Ebola outbreak in the Democratic Republic of Congo. But this one is also the worst, and the world's first in a conflict zone. Since 2014, about 2,000 people have been killed in northeastern DRC in fighting between armed groups. And now, since August, a record more than 200 people there have died from Ebola.
The Ebola epidemic in North Kivu and Ituri provinces surpassed that of the first epidemic in DRC's history, which occurred in 1976 in Yambuku, in the province of Equateur.
The health ministry says medical teams in the area are attacked an average 3 to 4 times a week, an unprecedented level of violence compared with previous outbreaks. 2 medical agents with the Congolese army were shot dead 3 weeks ago. 15 people were killed and a dozen children abducted in subsequent attacks around the town of Beni. The World Health Organization says it's become the outbreak's epicenter because of what it calls a toxic mix of violence and community mistrust.
The outbreak is not under control, and it's been a large number of patients in the town of Beni, and now we are very concerned about another town, Butembo, where you have 1 million people. And cases from Beni travel to the area of Butembo, and we're now worried that transmission will occur in that town.
This, he says, is a window of opportunity. A vaccination program has already reached some 25,000 people. Neighbouring Uganda has become the first in the world to administer a vaccine without an active outbreak, targeting frontline health workers near the border.
They're really trying their hardest to vaccinate as many people as possible who have potential exposures to Ebola virus, because the vaccine really seems to work. The problem is it's challenging to access people because of the instability in the area. And it's hard to ensure that people who have had a possible exposure to Ebola virus actually have access to the vaccine, purely for safety reasons.
And borders here are porous. These roads, like this one in South Sudan, lead across sovereign frontiers. And as people travel, they give Ebola the ability to travel with them.
Tracing them becomes something difficult, but good enough up to now we don't have any case of Ebola within Yei River State, but if at all there is any case that enters, it will be very challenging tracing those people who comes through the porous borders.
As the death toll mounts in the DRC, neighbouring countries are watching closely. Nastasya, Al Jazeera.